And meanwhile, you have been sending us your questions on Ebola, and I've got a team of medical experts here to answer them for you. So joining me now is Dr. Celine Gounder, infectious disease and public health specialist, Dr. Gregory Ciottone of Beth Israel Deaconess Medical Center and Harvard Medical School, and Dr. Devi of the NYU School of Medicine, and as I just like to call her, Dr. Devi, because it's easier to pronounce. So I went out on the streets of New York City to speak with folks. So let's hear from a gentleman who works in a hospital first. You work in a hospital?
Yes.
Yeah. Do you think our hospitals are prepared?
Yes, I do. Yeah.
The one in Dallas?
Well, that one was, the first case might have been tough for a hospital because they may have not ever had experience with disease like that.
Yeah.
But now that we know what can happen, people are going to be more prepared.
Dr. Ciottone, is he correct? Are hospitals now more prepared?
Well, yeah, I think that's true to a certain extent. I mean, this is all uncharted water, really. And what we did yesterday, we're going to do better tomorrow, certainly. But some of this is a factor, I think, also of a little bit of mystery around Ebola. Hospitals are not naive to infectious disease. I mean, we live through HIV, we live through other infectious diseases. We have very robust needle stick policies and body fluid policies in place today. But clearly there's something a little bit different about Ebola, whether it's a different mode of transmission, I'm not sold on that, or it's the fact that the half-life of the virus is so long outside of the body. We need to do things a little bit differently with Ebola, clearly. And we're learning. Okay, again, as we're watching the Nurse Nina Pham there being taken by ambulance to the National Institutes of Health in Bethesda, Maryland, we're answering your questions. And this one is for Dr. Gounder, and it's from Twitter, and it says, maybe the CDC should designate the one hospital in the USA where all Ebola patients go to limit risk. No?
Hi, Don. We have 4 biocontainment units across the country, including the NIH, Emory, out in Montana, as well as in Nebraska. The problem is that they have limited capacity to handle these patients. The NIH has only 2 beds, and we don't know where patients with Ebola are going to appear. Every hospital needs to be prepared to screen all their patients for risk factors for Ebola and symptoms for Ebola. And then if they have a positive screen, to do the appropriate diagnostic testing. At that point, they should be, once they have identified somebody who may have Ebola, they should be contacting their local health department, the CDC, and that's where the CDC Ebola SWAT team can come and assist until the patient might be transferred elsewhere. But I'm somewhat concerned that we only have the 4 biocontainment units. If we continue to see the epidemic spiral out of control in West Africa, we're definitely going to see more cases here, and those 4 probably won't be able to contend with all of them.
Okay. And again, thank you, Doctor, for that. We're getting, I would imagine we're getting fairly close to Nurse Nina Pham arriving at the National Institutes of Health in Bethesda. It has been about 30 minutes, and our Brian Todd, who's there on the scene, is saying that it would take about 35 minutes to get there, and we're getting fairly close, we believe. So, Dr. Devi, I want to play this. I think we have enough time to play it because this is a young man on the street who is really confused about how the virus spreads. Listen, Dr. Devi. Do you have any questions about Ebola?
Ebola? I mean, I've seen some. The problem is they say it's an airborne virus, but I don't really know this. You know what I mean? What does that mean? Like, technically, like, how does it spread? How easily does it spread? It seems like it can spread pretty easily if one guy can come into Texas and all of a sudden you have 20 other people that may be infected. So I just want to know exactly how it spreads. I've got like 20 different sources telling me 20 different things. I need somebody to just tell me exactly what's going on with Ebola.
So, Dr. Devi, he was not the only one on the street who said that. And even though, our health officials have been saying it is not airborne, some people just don't believe that. So what do we know? What should we believe?
Yeah, so there are a couple of things to consider. First of all, it's only spread through bodily fluids. It's not airborne. The difference is with bodily fluids, it has to spread through blood, urine, vomit, diarrhea. That actually has to come in contact with your own bodily fluids. So it's much harder to spread in that sense than things like flu or enterovirus or the viruses that we usually deal with. Now, there's another second part of it too. So, for example, let's say that Ebola virus gets into your blood. I mean, we're not just sitting there kind of defenseless. Our body, our immune system fights things. So there are certain viruses that we can fight better. We're not as good at fighting Ebola, which is why we're more concerned about it, because if you actually get exposed to it, then you have a problem defending yourself from it. The reason that people are more concerned with the gear is that we're just becoming more cautious. If someone's vomiting, if someone's bleeding abnormally, then you have to worry about that. So those people that we're following, they don't actually have the virus, they're not diseased, but we have to watch them.
All right, thank you, Dr. Devi. Thank you very much, Dr. Gounder and Dr. Ciottone. I'm going to go get now to our breaking news. CNN's Brian Todd at the Bethesda, Maryland, at the National Institutes of Health in Bethesda, Maryland, where Nina Pham is in an ambulance. She is arriving right now. Brian, are you able to see anything from your vantage point?
Don, we can see an affiliate helicopter hovering overhead, but we cannot see the actual motorcade arriving. It's arriving in a different entrance, but the building where she will be taken to is right behind me. It's Building 10, the Special Clinical Studies Unit here at the National Institutes of Health, a high isolation, highly specialized unit where she will be staying indefinitely until her recovery is complete. She is just arriving now. It took a fairly short time from the airport, about 40 to 45 minutes from the airport. And she's just
Brian,
pulled in under some sort
let
of
me
portico,
describe,
we're
since
told.
you're, let me describe the pictures here.
yeah.
What you're seeing is that the ambulance is backed, and as you said, into a portico, or some people call it porte-cochere, where she will exit the ambulance, and I think this may be the first time that an ambulance is pulled into a covered position. Usually they let the patient out in a driveway in an open setting with a number of people around. But we don't really see anyone around. I'm not sure if they have cleared the hospital and cleared an area for her. And again, this is an isolation facility, so they are probably, most definitely, I would imagine, they're used to dealing with this particular situation. And as Brian Todd reported earlier, this facility is equipped to deal with this. There is no air circulation into any other parts of the facility. And I do have my doctors who are still here with me. So as we're looking through this, Dr. Gounder, you're here in New York City. Let's talk about what's happening now in Bethesda, Maryland, as Nurse Nina Pham prepares to exit this vehicle. What happens next?
Well, the next thing that they'll do is they'll bring her into the isolation room. They'll be making sure everything is disinfected prior to her arrival. Once she gets there, you have double doors to enter the room. So when healthcare providers enter the room, they put on some of their gear before entering the room, and some of it prior to entering the antechamber, some in the antechamber, and then they enter the room. Coming out, you remove much of your gear in the antechamber, disinfect, and then come out of the second set of doors. And the idea between those, about having the two set of doors, is to prevent air from leaking out from the patient's room. It's what we call negative pressure, or excuse me, negative pressure, so that the patient's air that they're breathing in and out is not coming outside.
Yeah, and the ambulance is actually under our breaking news banner, but they're from what you can see, there we go. I don't think that she has exited yet, but we did see some people in hazmat suits and protective gear inside the hospital in a gurney being moved around. But again, this is Nurse Nina Pham. She left Dallas about 7:10 Dallas time, Central Time, and then is now arriving here on the East Coast at the National Institutes of Health. I also have with me Dr. Gregory Ciottone, who is in Massachusetts. You heard what Dr. Gounder said. There are all sorts of, there's protocol in place at this particular facility, doctor, that they did not have at the Dallas facility. And this is probably a better place for anyone who is tested positive for Ebola to be.
True, true. I mean, I think a medical center geared up like this is certainly a good place to treat Ebola patients. This brings up an interesting point, though, and that is the idea of quarantine or isolation. And one place I think we're a little bit lacking is, especially this early time in the onset of the Ebola here in the U.S., is our ability to detect and contain early on. You know, one of the keys to stopping a local infection from progressing to an epidemic is early detection and strict quarantine. You know, meaning quarantine where you are not in contact with others, and it's an enforced kind of quarantine, hopefully by the patient themselves with good education, understanding that, you know, you don't go into quarantine as if it is a death sentence. You know, quarantine is something that you can live, you know, very peacefully and comfortably in. If you never develop symptoms, you come out of it. If you develop symptoms, well, then you get treated. And in fact, you probably get treated, will actually have probably even a better outcome than if you weren't in quarantine, because your symptoms will be picked up quicker. So, you know, with good public education and the understanding of early quarantine and how that might nip these pandemics or epidemics in the bud, I think that's an area that we could improve upon. I think we have a narrow window right now here in the U.S. where we can actually do some better quarantine to eradication, rather than what's going on in West Africa, quite frankly, right now, where it's spread so diffusely that, you know, quarantine can still be used, but it's not quarantine to eradication. It's quarantine to improved or actually decreased propagation of the disease.
And before I go to Dr. Devi, I want to get back to Brian Todd. Brian, you were saying at this facility they are actually working on an Ebola vaccine?
That's right, Don, and it's really cutting edge. This is the first time in the United States that they're going to be testing an Ebola vaccine on humans. They're doing it here at the National Institutes of Health and at the Walter Reed Army Institute of Research, not too far away from here in suburban Maryland. So 2 facilities, government facilities in suburban Maryland, not far from Washington, D.C., are testing Ebola vaccines on human beings for the first time in the United States. It's going to take several months probably for them to determine whether these tests are safe and whether these vaccines are actually usable for the public. So, you know, there's a lot of anticipation of that. And of course, it can't happen fast enough for the victims and for the people who are really in need of a vaccine. But this place now, the NIH right behind me, is now on the cutting edge of the Ebola outbreak on 2 fronts. They're treating Nina Pham, and they're working on this cutting edge vaccine, Don. So this is really kind of where it's at as far as in the United States, where the fight against Ebola is occurring.
Brian Todd, thank you very much. Brian Todd at the National Institutes of Health in Bethesda, Maryland, where Nurse Nina Pham is. I want to get now to Dr. Devi. Dr. Devi is here with me in New York City. And doctor, you know, as we're looking at, as we looked at the ambulance arriving, I mean, this must have been a harrowing trip, and really a harrowing couple of days, if not a week or longer, for this nurse who has been diagnosed with Ebola. What happens to her now once she's in this facility? Our very own Dr. Sanjay Gupta said there really isn't, you know, a treatment or a cure of sorts. It's more about monitoring and taking care of a patient, keeping them comfortable, and providing them with liquids.
Exactly. So that's what we do with most people who have viruses. Even if you think about the flu virus, you know, you just try to get the person through it. So if a person has vomiting, let's say, you try to do something for their nausea. If they have diarrhea, you try to manage those symptoms. Now with Ebola, there are a lot more serious symptoms, like you can bleed, so you can suffer from blood loss and dehydration. So the idea would be to give people fluids, give them blood if they need it. They can have kidney failure or liver failure, so you want to observe for signs of that and try to manage the symptoms. But if you can actually help the person pull through that, then, you know, then they recover and they're all right. And one good thing here is we saw Nina Pham walking before. So, you know, it doesn't predict whether you're going to develop these complications, but at the same time, it means that overall, you're kind of in a better situation because, you know, you obviously have enough fluid to be able to stand without being too dizzy or passing out. You know, you have the strength to be able to walk. So I think that those are really good signs that she was able to do that.
It speaks to her health, at least gives us a snapshot at the moment of what Nurse Nina Pham is dealing with. And again, earlier, doctors, we saw her in Presbyterian Hospital in Dallas. Before she left, of course, the PR department of that hospital put those pictures out, put them on YouTube of Nurse Nina Pham there saying, you know, she's feeling well. She was crying, and she said that there were tears of joy. There she is in her hospital bed. But can we really, Dr. Gounder, can we really judge anything from a video that was posted to YouTube about her condition?
Well, she's not critically ill. We can say that much. She's not on dialysis. She hasn't needed to be put on a ventilator. And if she's walking, she's not on medications to support her blood pressure. So those are all great prognostic signs. But as Dr. Devi was saying, a lot of what we're going to be doing now is continuing to monitor her blood pressure, supporting her with IV fluids and other medications if she needs it. One of the things that is really deadly about Ebola is that it attacks the immune system, and so that puts you at risk for other infections. So they'll need to monitor for that sort of thing as well.
All right, all of you doctors, thank you very much. You have really helped us guide us through this, including our very own Dr. Sanjay Gupta, who has been stationed outside Emory Hospital in Atlanta, Georgia, where the other young lady who has been treated, Amber Vinson, another healthcare worker who was diagnosed with Ebola, was taken there as well.